I'm here with Brad Skanes today, physiotherapist, and he's known as @PhysioBrad on Instagram. And Brad and I are going to talk to you today about tennis elbow. Tennis elbow is a degenerative condition that causes pain on the outside of the elbow and most commonly affects people in the middle age, so between about 40 to 65 years. The condition, if left alone, usually gets better on its own within a year, but sometimes the pain can be aggravated by repetitive activity such as some sports and work, and patients can be so debilitated by the symptoms they require treatment. The most common treatment for tennis elbow, the one that's been proven to change the course of the disease, is physiotherapy. Sometimes patients can benefit from using straps or braces during repetitive activities such as sports, gym exercise or work if they can't avoid these. Steroid injections used to be a common treatment for tennis elbow, but is now not recommended as multiple studies show that they provide a short-term relief, but pain often comes back and is worse than if you did nothing at all. Surgery is very rarely now used for tennis elbow, and most of the times patients can be successfully managed with good physiotherapy. And it's key that that physiotherapy be exercise-based. So we want to hear from Brad today, his tips on how he would assess and manage a patient with tennis elbow.
So a physiotherapy assessment will look at a person's range of movement. It will look at their strength and work out when they get their pain. We will take some grip measurements, so we use a dynamometer to assess someone's grip strength and compare each side, because often when you have tennis elbow you have deficits in your grip strength and the force production around the elbow. And then once we've worked that out, where the deficits are, where we need to work, we then move into our rehabilitation program. So we can take tennis elbow in two levels. So we've got those that fall into the painful category and those that fall into our loading category. Those that are in that painful category, we need to settle the pain first, and this is where some of our taping techniques can be useful. Sometimes some manual therapy can be useful, and then some gentle exercise, what we call isometrics. Once we're outside of that painful category and the pain has settled, we then move into the loading category, where it's all about improving the strength of the muscle tendon unit.
Lots of patients sometimes give up on physiotherapy quite early, but I often say to them that a strengthening program takes some time. How long is a reasonable amount of time for a patient to commit to rehabilitating from tennis elbow?
Yeah, it's a tough one. It does depend on what stage you're in as well, but you're right, patients do tend to drop out a bit too soon. But if we're being realistic, a rehab program for tennis elbow will take 3 to 4 months. Sometimes that can be 6 months, sometimes that can be a bit quicker depending on where the category is. So I normally say you've got to give it about 3 to 4 months.
Yeah, and 3 months is what I usually tell my patients to try to give physiotherapy a chance to work and show benefit.